I feel really good. I'm actually like shocked that my legs look the way they do. I mean, it made me feel more confident that I was in the right hands.
Donna, thank you so much for taking the time today, because I know a lot of people would love to hear your story. Tell me, what was it like with the legs that you were dealing with before?
Well, the way I describe my legs, and I described it to my friends, was like my legs to me look like a road map, especially my ankles and my feet, the side of my feet. And it just kept getting worse. I wouldn't even wear sandals in the summertime. Well, I can tell you one thing, that now I can wear sandals. I have a girlfriend that owns a boutique and she sells shoes, and they're beautiful shoes. So now I'm looking forward to being able to go in there and actually buy sandals for the summer. I mean, I'm not going to wear short skirts at my age or anything like that, but I'm not self-conscious now about any part of my legs showing, or especially my ankles and my feet. Before, I would make sure that the shoes covered it, or I'd wear leggings or something like that. And then I tried leg makeup. It was all a pain. It never really worked that well. So I had just finally had enough of it. Years ago, I had had saline injections for spider veins, and they just came back. But this looked like it was something different. And so that's why I did my research and ended up at West Medical.
How long were you dealing with this?
Years.
Wow.
Yeah.
Yeah, more than 10?
Yeah, probably. But more recently, like in the last couple years, where I saw the veins in my feet and my ankles, and it was really ugly.
Did you have any discomfort or anything like that towards the afternoon? Tired?
Maybe tired, but nothing really that drove me to do what I did. I really came in for cosmetic reasons. I didn't realize I actually had a vein disease.
And what did people tell you when they saw your legs? Did anybody make comments?
And my friends are, of course, they would say, "Oh, I don't even see him. You have to look really close." And I said, "You're lying," because to me, I'm very fair, so they showed up a lot.
Well, we have pictures.
Oh, great.
we can show the before and after, if that's okay, and we can see. So, and how did you find West Medical?
I just started researching, and I'd called a couple places. I actually went to another vein specialist in Van Nuys, and that doctor wanted to strip my veins. And then I had heard that they don't even do that anymore.
Yeah, I mean, we did that, but that was 20 years ago.
Right, that's what I thought. And then she also said that, if I do that, if you ever have heart surgery, you might have a problem, because they take that vein, I guess, for your heart. So I wasn't really very comfortable with that. And I just kept researching until I found West Medical. And I tell you the truth, I wasn't that optimistic when I came in. I just thought I was going to get the same old story. Or just some saline injections, and that was it.
And how was the experience here from the first day?
It was pretty amazing because they were so thorough. They did an ultrasound, and it wasn't a quick ultrasound. It took quite a while. And when they started, I didn't understand what they were saying, but they were talking in medical terms that I definitely had congestion, and I actually had a problem, a disease. And so it made me feel more confident that I was in the right hands, because they didn't just dismiss it as cosmetic.
Sure. And they offered the options to you and what you could do and how we're going to treat it. And what was that like?
Well, they told me what the procedure was to get rid of them. Now I don't understand all the technicalities, because they did explain that the doctor would decide how to block the vein or cut off the vein. There's certain things he injects, but he chooses which injection to use to accomplish that. So I said, fine. I'm not afraid of pain, especially when I know that it's going to make me look better.
You came in for treatments. And how were you treated by the doctor and the staff?
Oh, they were unbelievable. The staff's really friendly and really, really nice. They make you feel comfortable. But when I met the doctor, he was not like your normal doctor. He just was so personable. And he did explain to me what my issues were and what he would do, and that it would take several sessions. It's not a quick fix. It's not for somebody that just wants to come and go. I mean, this has been a process. It's been several months. And he explained to me that it would be. So I felt totally confident, and he just put me at ease, and I did my research on him.
Of course.
I was really impressed with him. I mean, he's really an accomplished doctor. This is not all that he's done.
Sure.
And I've also had learned that he had written textbooks, and He's actually pretty brilliant.
Absolutely. And, obviously, if you needed that many treatments, you had very complicated legs. This wasn't just a straightforward
Right,
thing.
right.
Is that what you were told other places?
No, nope, was not. And what I really liked about him is he is so thorough. He's meticulous because he would, like, for my follow-up visits, he'd find things. I mean, I was pretty satisfied, like, further into the treatments, but he found things that he thought needed to be corrected, and he pointed them out. And so I returned again. They just tell me to return, I return.
Okay.
I don't even know what I'm scheduled to do half the time. I just bring my stockings and let them do it.
And how do you feel now after the treatments?
I feel really good. I'm actually like shocked that my legs look the way they do. I mean, I'm old, so I mean, they're not going to look perfect, but they're like, the color is like porcelain now. It's just amazing to me because before, I mean, and I'm not exaggerating, it was so ugly. I mean, they were on the side of my feet and all of my ankles, and a lot of people don't have that, but he did tell me that once it reaches that area, that means you do have congestion, and you can have serious problems later on in life.
Yeah, they could lead to ulcers and
Yes.
all kinds of problems, and blood clots, and we've seen.
Right.
And so I'm glad that you could take care of it, and you don't have to deal with the unsightliness or any of the issues that could potentially come up.
Right, yeah. I mean, it was twofold for me. I mean, since he corrected a medical problem that could potentially be very dangerous later on, the cosmetic part, it's just shocking to me how good my legs look.
Yeah. So, any special care? Can you tell people what special cares you had to do afterwards, after the procedure?
Sure. They bandage it, and then you have to bring in compression stockings, and he told me which, I don't know, it's called strength or compression it is. I think it was 30-40 or something. And so you bring those, and they help you put those on. Those are hard to get on, especially when you have arthritis in your fingers. But you put the compression stockings on, and you sleep with them the first night, and then after that, you just wear them for, I think it was a week, or maybe it was 2 weeks for the first procedure. After that, it's only a week. That's the only thing that is a pain, is the compression stockings, but it's not a big deal.
Okay, very good. And the fact that you don't have any pain after, and you're doing your normal activities after? Mm-hmm. Okay. So can you tell me about how the initial procedure was when you were there? What were you doing?
Well, the first procedure was a long procedure, and he actually goes up, I think, like with a catheter, and he's got a screen, a monitor that he's looking at to find the proper vein that he has to close up. So I'm laying on my side, and I had my phone, and I was just texting during the whole thing.
Oh, very nice.
I was just ignoring it, letting him do what he wanted. He would tell me what he's going to do, and he'd say, "You're going to feel a little sting here," and I would just nod, "Okay, fine," and just keep texting. To me, it wasn't quick. It was longer than I thought it was going to take. And then afterwards, after he's done, they want you to walk. So they told me to come back like in 45 minutes. So I just walked up to Target.
Okay, very good.
And then shopped and came back. And then they looked, because I think they're looking for blood clots, make sure there's no blood clots or something. I don't know.
Sure,
I think that's what he said.
Yeah, that's exactly right. So what you're telling me is you can get all your text messages done while you're getting this procedure done. You can run some errands right after the procedure, and then you go home.
Yep.
Okay, that sounds like a good deal to me.
Yep.
Okay. Did you pay for the procedure yourself, or did you have it covered by insurance?
Well, since it is a medical problem and it's actually considered a vein disease, Medicare paid 100% for it.
Oh, great. Okay. That always helps.
So I was thankful for that, yeah.
Very good.